And of course, we know you have plenty of coronavirus-related questions. So on each show this evening, we're featuring a different doctor with a different area of expertise. Monica Robins is in our Health Hub once again tonight with clinical psychologist Dr. Lori Stevick-Russ. Monica.
Hi, Jimmy. Yeah, a lot of people, this is new to me, a lot of people, health anxiety.
Yeah.
That's something that we forgot to think about,
right?
Like for people who are always worried about getting sick and that sort of thing.
Yes.
And I can't even imagine what they're going through right now.
Yeah, I actually am getting a lot of calls from people who will admittedly say, you know, I'm a hypochondriac, or I have this health anxiety and it's been there my whole life, either because of trauma. Some people have that because they've had medical issues or traumatic experiences around health, and then it remains a residual for them. But either way, it's that feeling of I've always worried and now I'm on worry steroids. So, you know, it's how do we manage that? What do we need to do to get through that part of it? Knowing that there's a legitimate kernel of worry, but you cannot be, you know, exponentially growing every day. We're in a marathon here. You and I were talking about that earlier. This isn't going away in the short term. We cannot sustain that level of anxiety and self-checking. So a couple of things that people should be thinking about. One is Googling symptoms should be outlawed. It should not be like, oh, I feel like I've got this, and so let me Google and see what that is. All that does is lead to more anxiety, more misinformation, more fear. So you need to know your body. You need to stay grounded on the 3 or 4 core symptoms related to the coronavirus and pay attention to those symptoms. You don't need to be checking your temperature 25 times a day, especially if you don't feel like you're sick or that you have a fever. So it's those things that we need to change the vicious, obsessive, compulsive loop, because our brain reacts to that. Our brain reacts to the rebound effect of me saying, do you think I'm okay? Do I sound bad? Do I look like I'm feeling bad? And then you reassure me, and then the brain says, okay, I'll pause for a minute. Now I need to be reassured again. So it becomes a vicious cycle. So really we have to help people learn to self-regulate now more than ever, stay grounded, know the symptoms, and know that the rest is your anxiety and your worry about getting sick. And doing that could potentially get you sick with other things, because you're again, we've been talking about this all week, driving your immune system down.
That's so important too, especially now. People need to know that if you're told you don't need to be tested, don't worry about it.
Exactly.
Lori, thank you so
You're
much.
welcome.
Back to you, Jimmy.
All right, thanks, Monica. Thank you, doctor.